I'm Dr. Lawball from Back to Health. And in this video, I'm going to go over with you some things you can do at home, some exercises and stretches you can do to help get you up and over the acute pain associated with plantar fasciitis. These exercises are designed and intended to be done first thing in the morning before you even step your feet down on the ground getting out of bed. We definitely want to warm up the bottom of your feet before we step down on top of them. A couple of things that I want to review with you, I think, that are very important relative to healing yourself from acute plantar fasciitis pain. The first thing, and I think it's very, very important, is that you can never walk around barefoot. So in the acute phase, in the weeks and months that you're trying to get out of that real foot pain, we've got to make sure that your feet are supported at all times. So what I want you to do is have a pair of, some orthopedic house slippers, or even just your regular sneakers sitting beside your bed, so that when you go to get out of bed in the morning, whether it's to use the restroom or brush your teeth, you have your shoes on or you have your orthopedic slippers on. The second thing that I want to go over with you is a lot of home exercises with plantar fasciitis that you'll see on the internet involve taking the foot and really trying to stretch the plantar fascia. So to take that foot and really pull that plantar fascia and stretch it really hard. We don't want to do that. In a home care setting, that's the one thing we're not going to do, is we're not going to overstretch that plantar fascia. Let's get started. The first thing we're going to do before we get ourselves out of bed is we're just going to warm up the bottom of our feet and our calves a little bit by doing what's called a toe crunch and splay. Very simply, we're going to flex our calves and point our toes, and then pull our toes all the way up to our nose, scrunch and splay. We're going to do this approximately 30 times, just to get the bottom of those feet and those calves warmed up. Good. 30 times, that should feel pretty good. Okay, so the next exercise that we're going to do is a tibialis anterior stretch. We're going to sit up. We're not going to put our feet on the ground and stand on them just quite yet. Going to warm them up a little bit more. And the way that we're going to do this particular exercise is we're going to pull the foot into flexion and then pull the big toe up to your nose. You should feel a nice stretch right here around the front side of your ankle and up the front of your shin bone here. So we return the foot back to neutral, and then for a 1-2 count, we just flex the foot and pull it up to your nose there. Pull that big toe up to your nose. Good. 1-2 count. Let it down. 1-2 count. Down. Very good. One of the things you can do with this stretch here is, in addition to pulling with this hand here, with your left hand, you can actually use your right hand on your calf to push. So at the same time you're pulling, you're kind of pushing, just to get a little bit better stretch in there. Again, we're going to do this exercise approximately 30 times. And even if you're only having foot pain on one side, it is a good idea, certainly to do that side, but it's a good idea to do both feet, just to warm them up here in the morning. Good. Nice shin stretch here, tibialis anterior stretch. The next exercise that we're going to do is just some toe and heel raises. Again, we're going to do about 30 each. We're not going to put a lot of pressure onto the foot when we do these. Just enough to warm the feet up here. Put both the feet on the ground. Push up on the toes. Push up on the heels. There's 1, 2, 3, 4, just warming the feet up. We'll do approximately 30 of these. Onto the heel, onto the toes, onto the heel, onto the toes. Okay, so now that we've gotten warmed up a little bit, we're going to very importantly go ahead and put our shoes on, because we're going to get ready to stand up and put some pressure onto our feet. And as I mentioned earlier, one of the big no-nos is putting pressure on our feet barefoot. So we're going to go ahead and put our sneakers on. The first standing exercise that we're going to do is called a split leg hamstring stretch. We're going to start out by stretching the right leg. So what we're going to do is we're going to step our right leg forward approximately about 2 feet to get a nice, decently wide stance, but we want to make sure that we're nice and stable. Then what we're going to do is we're going to use the hand from our back leg, and we're going to reach forward to touch down to our knee, or go as far down as our shin, or even our foot, if we have the ability to do so. Now, during this particular stretch, you're going to feel stretching on the backside of your calf, and you're going to feel it on the backside of your hamstring. The entire time during this stretch, we're taking our back hip, which is our left hip in this circumstance, and we're driving that left hip down to our right toes. So we're driving that hip down as we reach forward to get a nice stretch. During the entirety of this exercise, we're keeping our entire right leg nice and straight, and we're doing the same for the left, keeping it nice and straight. To switch up, we're going to come over to the left leg. We'll step the left leg forward, approximately 2 feet. We're going to reach down with our right hand, again, taking our right hip, driving it down to our right foot, keeping the, driving it down to our left foot. We're going to keep our left leg nice and straight. We're going to keep our right leg nice and straight, just like a pair of scissors. We're going to reach forward till we feel a nice stretch, the back of our left calf, the back of our left hamstring. And we're going to hold that position for approximately 30 seconds, 45 to 60 seconds if we feel like we want to get a little bit of a deeper, longer stretch. There's nothing wrong with that. We're going to really feel that stretch in the back of our calves and the back of our left hamstring. And here's a nice little side view of our split leg hamstring. Again, we step left leg forward nice and straight, keeping our legs, both our left and our right legs, nice and straight, using our back hand, which is our right hand here, reaching forward till we feel a nice stretch in the back of our left leg. For the last two stretches, we want to be facing the wall, or perhaps having our bed next to us, something that we can kind of stabilize ourselves on a little bit. But this is going to be what's called the standing gastrocnemius stretch. So to do this, we're going to stretch the left leg first, the left calf first. So we're going to step the right leg towards the wall just a little bit. We're going to brace ourselves on the wall and lean forward, paying very close attention to keep our left heel on the ground. We don't want our left heel coming up. We want our left heel staying right on the ground. And we're just going to lean towards the wall until we feel a nice stretch in the back of our left calf. Okay? If you don't feel like you're quite getting that stretch, one of the things you could do is move your calf back, your foot back, your left foot back just a little bit. And then again, lean towards the wall until you feel that nice stretch. Being very certain to keep your left leg straight as an arrow. We don't want any bending in the knee for this stretch. We want to keep the knee nice and straight and lean forward until we feel that nice stretch. Really, you shouldn't have much weight on your right foot at all. Your right foot could almost dangle in the air. We're going to do this stretch for 30 seconds at least, 45 to 60 seconds if we feel like we want to get a little bit more of a deeper stretch. And then we're going to switch. Put the right leg back, left leg forward, put a bend in your left leg, keeping the right leg nice and straight and leaning forward, bending down, leaning forward until you feel that nice stretch up the back of your right calf. Again, being very careful, we're keeping our right foot on the floor, keeping that heel down. We don't want our right heel coming up off the floor. 30 seconds, at least. 45 to 60 seconds for a little bit of a better stretch. We're good. The final stretch that we're going to do is very similar to the gastrocnemius stretch. It's called the soleus stretch. So we're going to assume the same position. We'll do our left one first. So to do that, we're going to step our right foot towards the wall, brace ourselves against the wall, and we're going to kind of bend that right knee until we feel a nice stretch, kind of lean forward until we feel a stretch in the back of our left calf. So we should feel a nice stretch here, keeping the leg nice and straight. This is the gastrocnemius stretch that we just did. We're going to go till we get a nice stretch there, and then we're going to just take that left knee and we're going to bend it just a little bit. And when we do this, we're going to feel a little bit more stretching down towards our heel, down towards our ankle. You may even feel like almost an increase in pressure in your ankle. That's okay, that's what we're doing. Again, with this stretch, just being very careful to make sure that we're not picking our left foot up off the ground. We don't want that. We want to have a little bit of bend in the knee until we feel that nice stretch real deep down towards our ankle in our Achilles tendon, the lower part of the left calf. Again, with this particular stretch, we don't have a lot of weight on our right foot. It could kind of dangle there if we wanted it to. But we're feeling that nice deep stretch in our left ankle. We're going to do the same thing with the right foot. So now we'll step the left foot towards the wall. Keep that right foot back. Bend the left knee. We're going to get into our gastrocnemius stretch that we were just doing. And then we're going to put flexion in the right knee, keeping the right foot on the ground, keeping the right heel on the ground. We're going to flex the right knee until we feel that really good stretch in the lower portion of our calf. We should be feeling the stretch here when we do this stretch, guys. You should be feeling it down here near your Achilles tendon. Maybe feeling some pressure building in your ankle a little bit. We're going to hold this stretch again, like all of our other stretches, at least 30 seconds. 45 for a little bit of a deeper stretch. 60 seconds optimally if we can do it. And that's the soleus stretch. These exercises are designed to be done at least once a day. Before getting out of bed in the morning is a great time to do them. But certainly if you want to improve your chances for recovery, you can go ahead and do them twice a day, maybe before you go to bed in the evening as well. If you're experiencing any pain or difficulty with any of the stretches, make sure you take note, and at your next appointment, let one of your providers at Back to Health know so that we can work with you to get any issues worked out for you. You're well on your way to recovering from your plantar fasciitis pain.